Good morning, and once again, welcome to The Breakfast. So those who are just waking up and just joining us, we've been through a bit this morning, but now we're going to be moving into something that is celebrated today. It is the International Day of Persons Living with Disabilities. It's a day to promote full and equal participation of persons living with disabilities across our country and across the world. It's a very important conversation that, of course, I hope we'll be able to expand into seeing the struggles that persons living with disabilities face in our society. We've invited David Anyaele, the Executive Director, Center for Citizens with Disabilities, and Idah Kadyamatimba, Physical Rehabilitation Project Manager with the ICRC Nigeria. Thank you both for your time, and thank you for joining us this morning.
All right, I think we'll
Thank you so much.
Okay, we'll kick off with Mr. Anyaele. Could you talk us through the relevance of commemorating this day and what progress has been made? Since it started in 1992?
Thank you so much. Today is very important to persons with disabilities across the world. It is a day that we celebrate our contribution to the society. It's a day that we appreciate the effort we have made to ensure there is, inclusive, accessible, and sustainable communities across the world. Here in Nigeria, we are celebrating the emergence of a Disability Act that protects people with disabilities from discrimination and harmful practices. Looking at Nigeria as a country, over the years, we've been into struggle for equal opportunity, struggle for participation, equal basis with others, struggle for stable infrastructure, struggle to eliminate all forms of discrimination against persons with disabilities and their families. And as today appears, we are, recognizing the effort, organizations of persons with disabilities have put in place in order to ensure that, people with disabilities participate in socio-economic development on equal basis with others. All over the world, people with disabilities are celebrating of their own contribution, and that is why today is very important in the life of more than 1 billion people with disabilities across the world.
All right, I'm going to go to Idah Kadyamatimba. I want you to, share with us, there's 25 million persons estimated living with disabilities in Nigeria. I want your quick thoughts on what exactly the biggest struggles are for these persons, discrimination, policies, infrastructural deficit also to assist these persons, whichever ones that you can, quickly throw at us, that persons living with disabilities face in Nigeria. And also the 2019 bill that was signed by the president to assist people living with disabilities. How has that helped in any way?
Good morning again. Looking at the challenges, I think the best people to talk about the challenges is people with disability themselves, because they are the people who experience the challenges every day. But from the ICRC point of view, what we try to do is to support provision access to physical rehabilitation services, especially, as you know, ICRC work in conflict areas where services are limited and the general everyday needs of people are affected by conflicts. So we work to provide access to quality services for people with disability, support their microeconomic empowerment whenever possible.
All right. Well, I guess Mr. Anyaele
these are some of the challenges which we have identified whereby people cannot get the basic physical rehabilitation services.
All right. Mr. Anyaele, I want you to take up that conversation as well. The Discrimination Against Persons with Disability Act that was signed into law by President Buhari. Where are we with domestication across states?
Yeah, thank you so much. We commend President Buhari for signing Discrimination Against Persons with Disabilities Prohibition Act, January 17th, 2019. This act provides or prohibits all forms of discrimination and harmful practices against persons with disabilities. It also prohibits construction of buildings without access for people with disabilities. It went further to provide for a commission for persons with disabilities. As I speak to you, the commission has been established. Members of the board of the commission has been nominated, and they are currently undergoing scrutiny at the National Assembly. As I speak to you, about 10 states has passed different forms of disability laws in the form of adopting the National Disability Act. The latest happens to be Ekiti State, that about 2 weeks ago, the Ekiti State governor signed into law the disability law of Ekiti State, which is just a domestication or adoption of the National Disability Act. We are concerned that very few states has passed law that prohibit discrimination against persons with disabilities, and we are calling on states such as Abia, Enugu, Imo State, Oyo State, Ogun State, Gombe, and many others to take measure to protect their own citizens with disabilities from discrimination and harmful practices by passing or adopting the National Disability Act. This is a key way of opening access, increasing equal opportunity, and enhancing people with disability participation in the socio-economic development of their states. One of the key challenges people with disabilities face daily is this issue of discrimination. After discrimination, the next is issues of environment. Where there is policy, it is always easier to compare people to respond to disability issues. The greatest challenge is that state institutions design their program activities at the exclusion of people with disabilities, and by so doing, the larger society go further to exclude, isolate, and stigmatize people with disabilities. Not only them, including their family members. So these are the issues that we are contending with, and we are hoping that with the increasing number of states that are adopting the National Disability Act, we are going to improve much more in terms of enhancing equal opportunity in Nigeria.
Go on, and because I still want to talk about the act that the president signed. Mr. Anyaele, I want you to go on and share what, the benefits of this act should be to persons living with disabilities. In what ways, should this assist them, or in what ways would this be able to, improve on the lives of these persons if fully implemented?
Thank you so much. The full implementation of the Disability Act will enhance equal opportunity. That is to say, the ability of people with disabilities to access education. Because one of the key challenges an average person with disability have is this issue of access to education. According to data available, less than 5% of children with disabilities have access to education. The Act provides for free education from primary to secondary school. The Act also provides for access to healthcare services. In fact, it provides free healthcare services for individuals with health impairment. The Act created a moratorium of 5 years, within which all public infrastructures in Nigeria will be made accessible. The challenge is that if you are a person on wheelchair and you are asked to go to a building that have up to first, second floor, or fifth floors, how do you access? Bulk of government infrastructures, public buildings used by state institutions, are not accessible to people with disabilities. In fact, from our study, over 99% of public infrastructures in this country are not accessible to people with disabilities, and this is worrisome. Also, government program activities are designed at the exclusion of people with disabilities. So you see one empowerment program or the other, you will discover that the goal and objective of such empowerment program are not designed to include people with disabilities. As such, family members, individuals with disabilities struggle much more, to access some of these government program activities on equal basis with others. This act went further to provide for participation in political activities. What that means is that all political parties in Nigeria, including the election management body, are to take appropriate measure to ensure that people with disabilities participate in the political activities on equal basis with others. What that means is that if this act is implemented holistically, people with disabilities contributing maximally to the socio-economic development of this country. People who want to pay tax.
All right,
Mr.
Anyaele, let's give some talk time to Idah as well. Idah, can you talk to us about this first of its kind in the Northeast physical rehabilitation center that has been commissioned by the ICRC? Of what import will it be for the people in that axis?
Well, the new physical rehabilitation, which was built by ICRC in collaboration with University of Maiduguri Teaching Hospital, will go a long way in providing access, because you find there are few centers who are providing physical rehabilitation services in the north. We had only one in Kano, and now with the new one in Maiduguri, it makes access easier for people with disability. They do not have to travel distances, and you find the quality of service which is going to be provided at the center in Maiduguri will be very high standard. The people are well trained, and it will make people in that area be able to get the devices which some of them never even thought of accessing.
All right.
So it's really a good step, and just to add on to that, it's collaboration, ICRC and University of Maiduguri Teaching Hospital. The services will not be free of charge. People will pay according to their capacity. There will be social assessment, financial assessment, so that they are sustainable for a long time. Otherwise, people are so much used into free services which collapse after a few years. But with people contributing, they also tend to appreciate, understanding also that many people in that area do not have.
Okay, let me interject quickly and ask you about the other activities by the ICRC to help people living with disability. Can you talk to us a bit more about the work that you do?
The work ICRC is doing is to support people with disability, have services like prosthetic limbs. After an amputation, someone doesn't have a limb. So the ICRC supports the production of those limb and fitting. And also we run a project, the surgical team project, whereby people who are injured in the conflict, they are able to get treatment at the hospital, and then for continuum of care, they will be referred for rehabilitation services.
It's also, maybe be a little worse in northern Nigeria, seeing the crisis over there. Back to David Anyaele, the year 2020 has been, tough, for people across the world, even here in Nigeria. What has it been like for persons living with disabilities? Has COVID-19 created an even tougher standard of living for these persons?
It's quite excruciating. Prior to advent of COVID-19, people with disabilities have suffered discrimination, exclusion, and isolation by state institutions, even in their program activities. With the lockdown occasioned by the COVID-19, the life of people with disabilities in Nigeria became more threatened. We suffered due to non-inclusion of people with disabilities in the distribution of palliatives across Nigeria. Many people with disabilities struggle to have access to materials that can help them. Those that are in need of Medicare, they also were badly affected. What worried us most was that even in the ease of lockdown procedure by different institutions and government, no mention was made around how people with disabilities will cope. As such, as we are celebrating today's International Day for Persons with Disabilities, which is speaking about, building back better towards inclusive, accessible, and sustainable post-COVID-19. It is important that state institutions recognize that people's abilities suffered most during this COVID-19 pandemic and lockdown. Therefore, adequate care measures should be taken to ensure that all post-COVID-19 response of the government are disability inclusive. We are saying that the Federal Ministry of Information should do better by creating awareness, by raising the rights of people with disabilities, so that other institutions of the state will take cue and be able to respond to the disability issue. One of our core challenges is that as ministries, departments, and agencies are going to the National Assembly to defend their budget, key line ministries responsible for people with disabilities are not, budgeting for people with disabilities. It's worrisome.
Yes,
What that means is that in 2021,
quite unfortunate.
we may suffer much more. That's the situation we find ourselves.
That's quite unfortunate, really, and we're hoping that the welfare will be better, especially with the act that was passed into law last year. But away from that for a second, the day, among other things, is to reflect, to learn, create more awareness, and to celebrate notable achievements of people living with disability. My question would be, what is your assessment of how we celebrate people with disabilities who have achieved and, beyond expectations in this country?
It is weak. It is weak in the sense that just look at most media awards that different media houses organize for people that have contributed to nation building. You hardly see a provision for that they recognizing people with disabilities. So you see different groups creating different awards to political parties, they give it to politicians without recognizing that people with disabilities are also contributing. An average person with disabilities who is participating in sports activities, go a long way to struggle with minimal support to get, gold medals for this country, outside Nigeria. We've also seen people with disabilities who are working in different endeavors, promoting and, making Nigeria proud in different countries of the world. Regrettably, when there are opportunities to recognize people who are contributing to nation building, state institutions, including private institutions, fail to recognize their contribution. That's why I commend your TV station for creating this awareness for us, for creating space for us to share our thoughts around this day, and also to call on stakeholders to begin to mainstream disability issues, to begin to create, an inclusive society that does not discriminate on the grounds of disability. You see different programs that are designed for the public. You hardly see, attention paid to include disability. These are some of the challenges we are facing, and we are saying that let us begin to change with advent of this Disability Act to mainstream and include people with disabilities in different facets of humanity, because we are contributing. We are also, playing our own part to ensure that our society improves in every facet of human endeavor.
All right, back to Idah Kadyamatimba. You had earlier mentioned that the center that, of course, has been set up in the north, of course, still requires some level of payment from these persons living with disabilities. How much better would it be if maybe there was some financial support to these centers and also, to the ICRC to ensure that every person who seeks rehabilitation can get it for either free or for a very, very subsidized rate?
Well, there is a price list which is developed together with the University of Maiduguri Teaching Hospital, and depending with the needs of the person, because it's not the same for everyone, people will be assessed accordingly. And then after going through the financial and socioeconomic assessment through the social workers, they will determine the percentage of prices. And also this is an opportunity for the for the hospital to lobby also for organizations or philanthropies who can support people with disability with paying for some of the services.
All right. Before we go, I want to ask Mr. Anyaele to quickly speak on the theme for this year, which is building back better towards disability, inclusive, accessible, and sustainable post-COVID-19 world. I want you to speak on the relevance of the theme.
Yeah, this theme is cogent, is apt, recognizing what international community is going through as a result of COVID-19. We are, we could say that here in Nigeria, we are better off, unlike people in Europe and America, where there is this issue of lockdown, of spread of COVID-19, of struggle of families to contain the spread of this virus. What we are saying is that across the world, systems are changing. Across the world, measures are being taken to, to improve the living condition of all after this COVID-19. We are calling on Nigerian government, especially the federal and state government, to ensure that all program activities are inclusive of people with disabilities, to ensure that all measures they are taking beyond this COVID-19 are accessible to all and is sustainable. And this can only be done if the Disability Act is implemented to the letter.
All right, Mr. Anyaele, I must say thank you very much.
Towards ensuring that people's disabilities benefit. Without that, we will struggle much more to be part of, the society after this COVID-19 across the world. We also ask
all right, Mr. David Anyaele, thank you very much for joining us. You are the Executive Director, Center for Citizens with Disability. We thank you for your time. And of course, Idah Kadyamatimba, the Physical Rehabilitation Project Manager, ICRC Nigeria. Thank you also for joining us on The Breakfast.
Thank you so much. It's my pleasure.
Thank you.
Have a good day.
Thank you.
So sad, part, where he mentioned that with all the conversations, concerning COVID-19 palliatives, and, it's also, good to realize that a lot of times persons living with disabilities are lost in the conversation. They're barely even brought up. Maybe because government policies do not remember, that they should be included. Maybe because, we have an attitude generally as Nigerians and across the world to not even remember, So it's important.
I don't prefer to say across the world, because in other parts of the world there is no building that does not have disability. Accessibility. It's only in Nigeria that people will build mansions and you won't see even a place for wheelchair to pass. We need to begin as a people. It's not all about government. What are we doing as individuals? In your capacity as an architect, what do you do to advise your clients to say, you're building a structure, can you consider the welfare of those who might not be able to climb the staircase? I remember my mom, when we're looking for a place to stay years back, she has a problem with her waist, so she couldn't climb staircase, and we were compelled to stay downstairs, even though most of the family members would have preferred we go upstairs because you have better air upstairs and all of that. So it's important that when people are building homes, they should consider that there are people living with disability that require assistance as well.
It's in numerous other ways that they should be included. Ramps, yes, for people who have issues with walking, but disabilities
it's beyond that, of course. It's beyond that, but at least that's social amenities. That's the very basic you can do. The pavement should be accessible to people who are on wheelchair, because not everybody that is mobile. That's some of the important things that need to be considered. Now, talking about the welfare of people living with disabilities during the COVID-19 period, it was, let me use the words of Dr. Jo Dumaki. When I speak with her, each time I say the word, I remember her abysmal, that she liked to use the abysmally low. So we need to work on that. But when you also think about it, we just saw in the news, in the headline when we did the newspaper review, that the 774,000 jobs is yet to kick off COVID-19 is at the tail end. People are yet to receive the monies that government had promised them. So we have a lot of work to do, and our job here is to continue to raise awareness, to talk about these issues, and hopefully one will sink in.
We have
Hello, hope you enjoyed the news. Please do subscribe to our YouTube channel and don't forget to hit the notification button so you get notified about fresh news updates.